Have you noticed that you don't have the same energy you had 10 years ago? Maybe climbing stairs feels harder, your muscles feel weaker, or your bones ache more often than they used to. Many people simply say, that's just getting older. But what if there was another reason? Today, I'm going to explain why vitamin D is one of the most important nutrients adults over 50 should pay attention to. I'm Dr. Sarah, and welcome to Health Simplified. Let's begin. Why this topic matters. Every single day, millions of adults wake up feeling tired. Some notice muscle weakness. Others experience frequent falls or bone discomfort. These symptoms can happen for many different reasons, but one possibility that healthcare professionals often consider is low vitamin D. Vitamin D isn't just another vitamin. It acts more like a hormone inside your body. Almost every major system depends on it in some way. It helps your body absorb calcium. It supports healthy bones. It plays an important role in normal muscle function. And it contributes to the healthy functioning of your immune system. The problem is, vitamin D deficiency often develops slowly. Many people don't notice it until it has already affected their health. Why adults over 50 are at higher risk? So why does age matter? As we grow older, our skin becomes less efficient at producing vitamin D from sunlight. That means even if you spend time outdoors, your body may produce less vitamin D than it did when you were younger. There's another reason. Many adults over 50 spend more time indoors. Some are retired, others have limited mobility. Some avoid sunlight because of skin cancer concerns. All of these factors may reduce natural vitamin D production. Diet can also play a role. Very few foods naturally contain significant amounts of vitamin D. Unless you're regularly eating foods such as fatty fish or fortified dairy products, it can be difficult to get enough from food alone. Certain medical conditions and medications may also affect how vitamin D is absorbed or processed. This is why healthcare providers may recommend testing for some people who are at higher risk. The signs you should know. Here's something that surprises many people. Low vitamin D doesn't always cause obvious symptoms. Some people feel completely normal. Others notice subtle changes over time. For example, you might feel tired even after a full night's sleep. Your muscles may seem weaker than before. You may have difficulty getting up from a chair or climbing stairs. Some people experience bone discomfort or become more prone to fractures. These symptoms are not specific to vitamin D deficiency and can have many different causes. That's why it's important not to assume you know the reason. A proper evaluation by a healthcare professional is the best way to identify what's really going on. One of the biggest myths is, if I go outside for a few minutes every day, I definitely have enough vitamin D. Unfortunately, it isn't that simple. Your age, skin tone, geographic location, season, time of day, cloud cover, and sunscreen use can all influence how much vitamin D your skin produces. That's why two people living in the same neighborhood may have very different vitamin D levels. And that's also why understanding where vitamin D comes from and how to maintain healthy levels can be so important.
One question I hear all the time is, if I'm low in vitamin D, how would I even know? The truth is, many people don't know. That's because low vitamin D often develops gradually. Your body doesn't suddenly send out a warning alarm. Instead, the changes can be slow and easy to overlook. You may notice that your muscles don't feel as strong. Walking longer distances becomes more tiring. Getting up from a chair takes more effort than it used to. Some people begin experiencing frequent muscle aches or bone discomfort. Others may simply feel like they have less energy throughout the day. The important thing to remember is this: none of these symptoms automatically mean you have low vitamin D. Many different medical conditions can cause similar symptoms. That's why proper testing is so important.
Why vitamin D matters for bone health. Let's talk about your bones. Did you know your bones are constantly rebuilding themselves? Even after the age of 50, your body is continuously removing old bone and replacing it with new bone tissue. Vitamin D plays a key role because it helps your body absorb calcium from the foods you eat. Without enough vitamin D, your body can't absorb calcium as efficiently. Over time, that may contribute to weaker bones and increase the risk of fractures, particularly in older adults. This is one reason healthcare providers often pay close attention to bone health as people age. Vitamin D and your muscles. Many people think vitamin D only affects bones, but that's only part of the story. Your muscles also rely on vitamin D for normal function. Research suggests that maintaining healthy vitamin D levels supports normal muscle performance. When muscles become weaker, simple everyday activities can become more difficult. Climbing stairs, carrying groceries, getting out of bed, even maintaining balance while walking. For older adults, maintaining muscle strength is important because stronger muscles can help reduce the risk of falls and support independence. What about the immune system? Another reason vitamin D receives so much attention is its role in the immune system. Vitamin D helps support the normal function of immune cells. Scientists continue to study exactly how vitamin D influences immune health. While vitamin D is important, it's not a magic shield against illness. Healthy nutrition, regular exercise, quality sleep, recommended vaccinations, and routine medical care all work together to support your immune system. No single vitamin can replace these healthy habits. Can you get enough from food alone? This is where many people are surprised. Unlike nutrients such as vitamin C, vitamin D is naturally found in relatively few foods. Some of the better dietary sources include fatty fish, such as salmon, mackerel, and sardines, egg yolks, fortified milk, fortified plant-based milk, fortified breakfast cereals. Even with a healthy diet, some people may still have difficulty meeting their vitamin D needs. That's why healthcare providers sometimes recommend blood testing for individuals who have symptoms or risk factors. Understanding your vitamin D status is much more helpful than making assumptions. And before you decide to buy a supplement, there's one very important fact you need to know. Before you decide to buy a vitamin D supplement, there's something very important you should know. Many people believe if a little vitamin D is good, then more must be even better. But that's not true. Vitamin D is an essential nutrient. However, taking high doses without medical advice can be harmful. Because vitamin D helps your body absorb calcium, taking too much over time may cause calcium levels in the blood to become too high. This can lead to problems that affect the kidneys and other parts of the body. That's why it's always best to talk with your healthcare provider before starting supplements, especially if you already take prescription medications or have an existing medical condition. How can you help maintain healthy vitamin D levels? The first step is simple. Know your risk. If you're over 50, spend very little time outdoors, have osteoporosis or another bone condition, or your healthcare provider has concerns based on your symptoms or medical history, they may recommend a simple blood test to check your vitamin D level. If your level is low, your healthcare provider can recommend the right approach for you. That may include eating more vitamin D-rich foods, getting appropriate sunlight exposure when suitable, or taking a supplement if it's medically recommended. The key word is personalized. There's no one-size-fits-all answer. Healthy aging is about more than one vitamin. Here's something I always tell my patients. There isn't a single vitamin that can stop aging. No supplement can replace healthy daily habits. The strongest foundation for healthy aging includes a balanced diet, regular physical activity, strength and balance exercises, good quality sleep, managing chronic health conditions, regular medical checkups, and staying socially active. Vitamin D is an important piece of the puzzle, but it's only one piece. Final thoughts. So, what should you remember from today's video? Many adults over 50 may be at increased risk of low vitamin D. Vitamin D supports healthy bones, muscles, and normal immune function. Low vitamin D doesn't always cause obvious symptoms, and similar symptoms can have many different causes. Rather than guessing, the best way to know your vitamin D status is to speak with your healthcare provider, who can determine whether testing is appropriate for you. Small, informed choices made consistently over time often have a much greater impact than chasing quick fixes. If you found this video helpful, subscribe to Health Simplified for more science-based health education explained in simple language. Leave a comment below. Have you ever had your vitamin D level checked? Thank you for watching. And remember, healthy aging isn't about finding one miracle vitamin. It's about making smart choices every day. Medical disclaimer. This video is for educational and informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Individual vitamin D needs vary based on age, diet, medications, medical conditions, and lifestyle. Always consult a qualified healthcare professional before starting or changing any supplement or treatment. Never stop or adjust prescribed medications based on information from this video.